We're chatting with Dr. Tony Dodek, who is Chief Medical Officer for AllWays Health Partners. Let's talk about cardiovascular disease. Now, this is a biggie. I'm not in the medical field, but I'm pretty sure the heart is an important thing inside your body. And can you talk a little bit about why it's so important to keep heart health a priority?
Obviously, your cardiac health is critical to your overall health, and it continues to be a significant public health concern.
Right.
In the United States, approximately 6% of adults have heart disease. And this is really a preventable condition that if we all ate a little bit better and exercised a little bit more, and didn't smoke and got plenty of sleep, we could decrease the risk of heart disease and the complications such as stroke.
What are some of the signs for people to watch for to sort of give an indicator that perhaps your cardiovascular health isn't what it should be?
Well, that can be tricky because it's different for different individuals. If you're having a decrease in exercise tolerance, you're getting out of breath more quickly.
Yep.
You've noticed chest pains or tightness in your chest that you didn't experience before. Those would be two of the major reasons to have an evaluation. In particular, if you have risk factors, you should be a little bit more vigilant, and risk factors include things like strong family history,
Yep.
obesity, high blood pressure, or a history of smoking.
You mentioned kind of some of the common sense ways to keep your heart healthy: diet and exercise and sleep, clearly things that can help. What are some other ways people can work to improve their daily heart health?
Those are probably the most important things. It's really just some common sense measures, and it's lifestyle changes that really can make a difference no matter what stage of life you're in.
Right.
So ideally, as adults, we continue to get at least 30 minutes of active exercise 3 times a week. We're good about limiting our intake of red meat and increasing portions of fiber and that type of thing. But it's pretty basic interventions like that which are the most effective.
We're talking with Dr. Tony Dodek, who is Chief Medical Officer for AllWays Health Partners. I wonder if you could talk a little bit about maybe some new approaches you're seeing in the healthcare field that are helping to keep people heart healthy.
Yeah, maybe what I'll do is just give you a little more details on the program I mentioned earlier,
Sure.
the iHeart Champion.
Yep.
So this is a remote medical management program that uses advanced algorithms to identify patients who may be at risk of heart disease, heart attack, and stroke. And then once identified, these folks are referred through their primary care providers to be enrolled in this program that provides customized care and personalized communications through one point of contact. This point of contact is a navigator who is connected to an extensive coordinated care team, and the navigator uses protocols that have been developed by the expert cardiologist at Brigham and Women's Hospital. And by use of text and telephone, they can manage their medications, check their blood pressure through Bluetooth-enabled devices, and decrease their risk of heart attack and stroke significantly. And this is a program that currently is only offered through AllWays Health Partners, as we're a member of Partners Healthcare, which is also consists of Brigham and Women's and other facilities. So the early results are really quite remarkable in reducing the cholesterol and blood pressure for participating patients.
Do you think this is going to start spreading rapidly when people see the success of this?
I do, and I think it's generalizable to other conditions.
Yeah.
So in addition to these two, I could foresee it being used for heart failure or diabetes or chronic lung disease.
Dr. Tony Dodek is Chief Medical Officer for AllWays Health Partners. Dr. Dodek, thank you so much for coming on. I have, in this short span of time, learned a great deal, and it's all useful stuff. I really appreciate your time.
It was my pleasure, George. Thanks for having me.